Now, I'm going to briefly talk about important things to look at when reading an article about diagnosis. It's really important to look at the presence of the reference standard and the quality of the standard. For example, in this paper, the reference standard is the diagnosis of dementia established by a senior psychiatrist using ICD-10 criteria in a multidisciplinary meeting. The diagnosis of dementia is aided by multiple studies done on the patients, including lab studies, imaging, neurological testing, and psychiatric testing. It's also important to see if the reference standard was performed on all the patients, which is the case in this study. We also have to look at the study population to see if it's similar to our population. In this case, the study population are patients admitted to a hospital in Germany, mostly geriatric patients. This is similar to our population of geriatric patients. However, the patients can have different characteristics in the United States from those in Germany. The next step is to look at the calculations. It's important for the study to mention the sensitivity and specificity of the diagnostic test and for a receiver operating characteristic curve to be obtained and the area under the curve to be calculated, which is the case in this study. Lastly, it's important to check for the practical use of the test being studied. For example, the Bamberg Dementia Screening Test can be administered in 7 minutes inpatient, and it's easy to administer to the patients, so it's practical to use. In summary, the Bamberg Dementia Screening Test is one of the tests that can be administered in patient to screen for dementia. Thank you.